Welcome back to Hardball. This week, the Senate passed a bipartisan bill that would provide health insurance for millions of children in low-income families. The majority was more than enough to overcome the veto repeatedly threatened by President Bush. So the Hardball debate tonight, will this bill cause to further the government's takeover of the health care industry? With us is Carrie Lukas. She's the Vice President for Policy and Economics for the Independent Women's Forum. And Diana Zuckerman, who is the President of the National Research Center for Women and Families. Diana, you hear about this bill, you hear it described, and you read about it in the paper, you know, providing more and better health care for millions of children from low-income families. It seems like a no-brainer. Everybody would sit there and nod and say, hey, yeah, that's great, sign me up. And yet you have reservations about this.
About it at all. I think it's a wonderful idea and very important because, of course, what we really want is for children to get the health care they need, and for pregnant women also, whenever possible, to also get the care that they need. So I think this is a no-brainer. I think it's a great idea.
Carrie, do you agree? I mean, should this bill just sail into legislation and become law immediately? I mean, won't things be better once that happens?
No, I think we need to be real careful when we think about what this bill does and what it doesn't do. The S-CHIP program was supposed, there already is a program that focuses on low income, the truly poor folks, and that's Medicaid. This is about providing health care for those who are above who are supposed to be low income. But in fact, with this bill, the bill passed by both the Senate and the House would do is really change eligibility. It removes a lot of requirements, so it wouldn't necessarily be targeted to low-income folks at all. And what this really is something about moving more people into government-run health care, which isn't something that a lot of individuals want. And I think that all of America should really be concerned about this drift towards socialized medicine.
All right, Carrie, you seem to have done something that I have clearly not done and read the bill, or at least know a lot about it, a lot more about it than I do. So if you could, for me, could you define, under the terms of this bill, the phrase, the term, the word children? Who are children under this bill?
That's one of the big question marks, because it's not targeted towards children. This gives a lot of leeway to states to define who they're going to provide this health benefit to. It's not only children; it's also children can be defined up to in their 20s. There's some adults and childless individuals are also being defined as children. Which, you know, I'm all for giving states leeway, but I think we need to be really careful, because what this is really a move to move many people who actually have insurance will be moving towards government insurance. It really is a move from private insurance to government insurance, and that's something that affects all of us. It's something we should really question.
Diana, do you agree with that? I mean,
it's just not true. First of all, the program currently, over 90% of the people covered in this program are children, and almost all of them young children. It's true that the changes would open that up a little bit, but still about 90% of the people in it are either going to be children. Maybe that might include pregnant women. And in terms of poor people, the vast majority of the people on the S-CHIP program, the children as well as the pregnant women, are at 200% of poverty level or less, and that's about $40,000 a year for a family of 4. And although that may not seem like dire poverty, obviously it isn't, but insurance costs at least $1,000 a month for a family. And so obviously it's very, very difficult to afford health insurance if you're going to pay over $12,000 a year and you only are earning less than $40,000 a year. So rather than have people have to decide between food and shelter and health insurance, it's very important. And I just wanted to add one other thing, that although it would include some parents, not very many, it's very important to children that their parents have health insurance. If you have children who get, cancer, obviously that's terrible, but if their parents get cancer and die and can't take care of them, that's also terrible for the health and welfare of those children.
Diana, are you concerned at all that under this bill, under the provisions of this bill, that some people who now have Blue Cross Blue Shield or whatever private insurance plan they might have, might think, hey, I've got a better deal coming if I go over into this government program, and that the government program swells with people who don't belong in the government program?
Well, there's two things I want to say about that. First of all, it's not government health care. This is all private health care. The government pays for it, but it doesn't provide it. It's not like the VA system, which is a government program. This is, private doctors, regular HMOs, and so on providing care. It's just who pays for it that's different. The other thing is that there are protections in the bills, and I'm sure that the final bill, which we don't know what that's going to look like, but they will have some protections. One of the ways to protect against people dropping their regular insurance is to have a waiting period. So if somebody dropped their regular insurance, they would not be eligible for this program for at least 3 to 6 months, and that would be a risk that would be much too big to take.
Okay, Carrie Lukas, hurry up quickly, about 15 seconds, last word, go ahead.
Well, I think everyone wants to have health insurance for everyone, but there's better ways to do that. We need to begin by looking at changing the way that our healthcare system is structured, and the employer-provided, deduction for employer-provided healthcare is really unfair to many people, mostly lower-income people and the self-employed, and that's what we need to begin reforming if we want to cover people with health insurance.
Carrie Lukas, Diana Zuckerman, thanks very much. All these years, all this talk, all these politicians, still healthcare is a cripple for too many. Up next.